Hi friends, today we will be discussing regarding the preparation for DNB CET 2018. The foremost important thing is you should not treat this exam anything different from what you have already been given. Let us suppose you are a person who has been preparing for NEET, preparing for AIMS. DNB CET may have a different pattern, different allocation of questions for each subject, but your basic preparation skill for any exam remains the same. So, DNB CET has a total of 300 questions in two parts, part A, part B, which around 3.5 hours. So you have to be careful in this. As most questions are expected to be one-liners, this is readily possible. What is most important, that a lot of questions are expected to be image-based. What I would suggest is that you should try and focus on image-based question on the first attempt itself. Generally, image-based question needs concept-based learning, it needs application, which may not be possible if you are falling short in the end. You are falling short of time in the end. So what I would suggest is that for image-based question, try to devote as much time as possible. It is warranted because that you can compensate with one-liners. But if you leave the bulk of the image-based questions in your questions for review, then in the end you may panic and you may lose time. So it is very important that in your first attempt of all 150 questions in each part, you will try to attempt all image-based questions in the first attempt, giving your maximum effort. In case they are totally unapproachable, then you can leave them for review. As most of the other questions are one-liner and you can compensate the time. The next important thing is how you approach the exam. The first part of the exam has the bulk of the first year and the second year subjects. But what is most important to note, that the DNB gives more importance to your first year subjects like Anat, Physio and Biochem. So in Anat, Physio and Biochem, out of these three, the first two things, the Anat and the Biochem, you are expected to get good amount of image-based questions, because a relevant anatomy image of individual system from embryology may be asked, and you may be asked to label that, identify a particular syndrome associated with that region, or even in some cases you may be asked to identify any anomaly which is characteristic of that region. So you can expect a good amount of image-based questions from Anat, and in biochemistry you can be asked good amount of image-based questions based on the cycles. For physiology, you should particularly focus on CVS physiology and neurophysiology. In CVS physiology, you are expected to get good amount of questions from ECG based question, cardiac cycle, graphs of CVS pressure volume curves, and the action potential graphs and muscle strength graphs. So all these are important image based questions which may be asked in the physiology portion. Apart from that, what you should focus is that you should try and summarize in anatomy the relevant blood supply and the nerve supply of individual systems, so that if you try to revise it at the end, at the last day, you can brush it up quickly. So try and make a good note of all the relevant blood supply and the nerve supply of various regions, which can help you answer individual one-liners. After covering the first year subjects, now we move to second year subjects, of which pathology and microbiology are the two subjects from which you get the bulk of the image-based questions. Especially in pathology, you can get good amount of image-based questions from hematology, and especially from individual portions like immunology. So immunology as well as your hematology, especially the WBC part, can yield good amount of image-based questions. For microbiology, what I would suggest is that you should focus on individual OVA, the individual cycles which can be done from your class notes, or you can do it from CDC based cycles. You should know for each organism what is the infective stage, what is the host, which category of host it is, because they can be good one-liners, or you can even be asked to complete the cycle in the form of an image-based questions. So this is relevant for microbiology. Apart from that, the culture media, the stains, they can be asked just individual image-based questions. The next subject is pharmacology. In pharmacology, what is most important to that don't go and start learning eccentric side effects. Stick to the basics. Like for most drugs, you can have very rare side effects, or you can have very common side effects for very rare drugs. That is not the point. You may still have questions in the exam which are targeting very difficult side effects or very difficult properties. But I would still suggest that you should focus on only common things, because at the last moment, if you try to mug up difficult side effects or new side effects, you may tend to forget what you have already learned. So, especially for a subject which involves a lot of learning like pharmacology, I would still suggest that you should stick to basic side effects, basic properties, and try not to learn eccentric things. Apart from that, the newer drugs can be asked in the form of one-liner questions in DNB CET 2018. Coming to the next subject, which is forensic. Now, the role of section, the IPC sections and toxicology is very important in DNB CET, because a lot of questions can be yielded from toxicology of individual toxins or drugs as side effects, or you may be asked a clinical scenario based question describing the poisoning and the treatment of choice. So that is very, very important. So in forensic, if you have to focus, toxicology and IPC section are very important. Next is ophthalmology. In ophthalmology, what it suggests is glaucoma, retina, cornea. These are the three main important topics. Apart from that, the neuro-ophtha can be useful. In some cases, you can get image-based questions on the basis of dark room procedures or tonometry. So this is the part A. So in part A, you've noticed that the bulk of the paper will come from your first year, followed by your second year and a short subject. So you need to focus on these subjects. This is anatomy, physiology and biochemistry, because nearly half of your paper is going to come from this. Now coming to the part B. Now part B has lot more subjects as compared to part A. So here you have to plan your study schedule. If you notice that the bulk of the question is going to come from your final year subjects, which is your PSM, which is general surgery, the obstetrics and your general medicine. So these are from the bulk of your paper. More than half of your paper is going to come from this. Whereas small subjects like ortho, anesthesia, radiology, psychiatry and dermatology together combined contribute to 27 questions. So if considering that DNB CET is going to stick to the number of questions they are going to give, though there is no hard and fast rule, but just gives you a general idea that in such a paper, leaving out on some crucial subjects like PSM and medicine and focusing on more on short subject like derma, anesthesia, radiology will not yield much. But you can get individual questions based on the type of the system which is used in X-ray machines, the system uses CT, the basic principle like ultrasound, MRgraphy. Apart from that, you can get sign-based questions, especially in DNB CET. So, especially in your last days of preparation, it will be good that you can brush up the basic signs which you see frequently in medicine and surgery, because they can yield good one-liner questions. Apart from that, for orthopedics, you can do the summary which is given in Dr. Apu's book, and you can do the fractures which are very relevant. Other subjects like derma, they are very, very important, especially for your image-based questions. So for common diseases, dermatology, the papillovascular disorder, the STDs, especially the relevancy. Now, you see, dermatology and sexually transmitted disease together contribute 6 questions. So STD itself as an individual topics become very important. So you can get 1 or 2 questions directly from sexually transmitted diseases or the relevant images. Now, after discussing the individual parts, most important thing is your strategy exam. Whether it's AIMS exam, whether it's DNB CET, whether it's PGI. So, as we know, we have total 300 questions and each part has 150 questions. For 150 questions, you have 210 minutes. You have 150 questions. So, you should try and finish all these 150 questions. At least read them once in your first 150 minutes. So, this will give you a sufficient time to review your questions which are left. It is very important that we should not be misled by the fact that number of one-liners are much more in DNB CET, so you do not pay heed to the options. That is totally a wrong approach. Don't try to finish the one-liners in half. Sometimes the question is tricky and the most obvious options are glaring at you. But because you don't read all the options, you tend to mark with an instinct. So that is a place where you will think that most of your one-liners are correct, but you tend on losing a lot of marks in the exam. So what I would suggest is that read all the options, irrespective whether it's a one-liner or it's a lengthy question. But the only thing is, sometimes you may not have any clue at all about the question. Then at that stage, a good option can be to read the options first. You read the options first and then try to apply the options in retrospect with the question given. Sometimes that can give you a clue. Next thing is about the attempt. Now there is 1/4 negative marking in this paper. So what I would suggest is that all of you should keep a high attempt in such a paper. So if out of 150 in part A, I would still suggest that you should attempt at least 140 questions. Because let us assume, even if you get 40 questions wrong, with 1/4 negative, it amounts to around 50. Let us suppose out of this 40, had you got 30 questions wrong and 10 you got correct. So if you divide 30 by 4, so it comes around 7.5 to be negative. Plus you will have 10 positive. So in totality you have 2.5 marks in positive. So this gives you an idea that keeping an attempt high will only yield a positive result in such a paper. So don't be intimidated unless until you have no clue, neither from your instinct or from the question or from the options. The options are very important. Sometimes you will not be able to answer the question just by focusing on the questions. You need to focus on the individual options, try to eliminate them, apply in retrospect and answer the question. Try and keep your attempt high. And last and foremost, your focus. Your focus during the exam. That is very, very important. You have to see the image-based questions from all angles. Don't try to focus on individual things. See the total picture as a whole. Because sometimes we get too fixated with individual points in an image and we forget the bigger picture. So it's just like you don't need to focus on a tree in a forest. You have to look at overall. And for image-based question, what is most helpful is that reading the options first. First of all, you read a clinical scenario, you see an image, and then you start guessing what it could be. But what is more important that if you read the options, because if you read the options, it may happen that most of your thought process may change, because now you are narrowing your thought process only on 4 options which can be applied to that image. So reading the options first in an image-based question can help you solve them faster. And apart from that, you need to be confident. Try and revise your basics. Don't try and mug up new things in your last 20 days. And make good notes so that you can revise at the last time. Thank you and best of luck.